When COVID became the crisis that it did earlier this year, it impacted obviously not just Duffy, but also virtually everybody on the Cape and elsewhere. I think concerns specifically as to Duffy in the early days were, would the organization continue to be able to treat the patients who depend on it for their care? We were very pleased in how the organization did respond, from the CEO down through leadership team, management, staff. Everybody jumped, as they always do. It's such a mission-driven organization.
So when the governor issued the emergency declaration in mid-March, we did an amazing turnaround as far as switching our services to the telephone. We closed the building to traffic from our clients to regularly scheduled appointments. Of course, our patients do come as they need us, so some people still did come to the door, but we pretty much switched everything to over the telephone within the matter of 8 days.
Also, the funds, the grant monies that the center has from the federal government and elsewhere were able to be utilized towards allowing staff to continue doing what they do.
We partnered really effectively also in the early days of the pandemic with the whole emergency management structure for the County of Barnstable. Through the Massachusetts Emergency Management Agency, we were able to access a mobile shower unit. And we pulled it up and parked it in our parking lot, and we were providing dozens and dozens of showers every week. And what we learned through this process was what an outreach tool a simple shower could become. So people would come even if they didn't want a shower because they knew that our case managers and our recovery support staff were there, so they could connect with, the patients could connect with our staff and have some of their immediate needs met. Another piece that we did was the breakfast program that normally fed folks was closed because of COVID. So we partnered with the Federated Church, also located on Main Street, just a wonderful partner to us and all the other homeless providers on the Cape. We partnered with them because they have a kitchen. So what we did was we prepared bag breakfasts Monday through Friday, and our volunteers and staff would hand the bag breakfast out the window to the clients so that they wouldn't have to go without breakfast. So it was no holds barred. You know, when we found, when we discovered that something needed to be done and nobody else was doing it, we just kind of jumped into the fray.
The sense of purpose, the sense of accomplishment is something that is very gratifying to be involved with as an organization, particularly where many times the people who are involved, the patients and the clients, are very fragile and they're in a very tough place in life. And here is a group of people, here is an organization that is dedicated to trying to help them. And that's a really great thing to be.
I have to say that our staff have just performed magnificently, and our management team has just gone all out. And all of these programs that I mentioned, every one of them took weeks and hours of time to develop, and barriers that had to be, huge barriers that had to be overcome and climbed over. So everybody, every single person on the team has performed magnificently, and I am just so proud of what they've all accomplished on behalf of our patients.